So, given your speech over the weekend in Helsinki, you did say that you were talking about autoimmune diseases in a veterinary circumstance in your profession. Would you like to talk about that a bit more? And specifically, do you feel that the autoimmune diseases in animals are rather wider spread today than before? And is this a serious problem in your opinion?
In my opinion, it's an enormous problem, and it's a very quiet, stealth problem that is actually going under that radar. A lot of people are missing it and not understanding it. Cancer, for example, gets a lot of attention, but actually there is probably a lot more autoimmune disease underneath a lot of animals' problems than there actually is cancer, and yet the light's not shone on it. And we certainly know this from human medicine, that there's probably nearly 3 times more autoimmune cases than there are cancer cases. And yet again, cancer gets most of the attention. So yes, indeed, it is a huge problem, and it's a growing problem. It's hard to actually get statistics on the numbers, but in practice we're seeing more and more cases. And of course, recognising that diseases we didn't perhaps think were autoimmune, such as pancreatitis, may well be.
How do you know for sure that a condition is AI?
Well, I mean, there are diagnostic tests that can be done to find autoantibodies, and as this world is advancing and genetic testing is advancing, you can diagnose them so that it's a known. And because we're now finding out that more and more things really are autoimmune and not what we first thought they were.
Right, right. In terms of differentiating your practice from the conventional to the homeopathic veterinarian, are there differences that you as a homeopath slash veterinarian see that you are doing rather than what your colleagues in the field are doing?
Well, it's mostly in the therapy. I mean, the first and most important thing to me now is still good diagnostics. It's absolutely fundamental. You have to know the disease you're dealing with, right, regardless. Whether you're a homeopath, an acupuncturist, it doesn't matter. It's about good medicine. So first know the disease. Good diagnostics is paramount. Actually understanding the disease from the so-called conventional viewpoint, I think, is also really important to do, and to know where the conventional world is coming from with this. So for example, in autoimmune disease, we are learning about the triggers for autoimmunity. And that's an uncomfortable world for conventional medicine, because many of the triggers for autoimmune disease are the very things that we're using conventionally, such as the drugs we're using, the vaccines we're giving. So it sits uncomfortably, and homeopathy doesn't say you can't use these things, but it says let's look at what we're doing with them, and let's use, for example, vaccination in a much more thoughtful way. And in homeopathy we've also got therapeutics that we can use to actually counter some of these issues once the triggers have actually gone into an animal. Indeed, treatment for other diseases, or treatment that is, or preventatives such as vaccinations, right, in susceptible animals, and this of course is the key. It's not all animals will get an autoimmune disease if they are vaccinated, or all animals will get an autoimmune disease if they encounter a certain toxin, a chemical put on their skin, for example, for flea or worm treatment. But a susceptible animal could, and this is the education that we have to be doing as homeopaths and integrated veterinary surgeons and, you know, lay animal practitioners. We have to start to get this message out, and we have to get the message out as well to the veterinary profession that autoimmunity is seriously a growing problem, and we have to stop mindlessly giving therapeutics to animals when they're susceptible.
How do you know as an animal owner whether or not your animal is susceptible? And indeed, what are the circumstances in which an animal owner should think of autoimmune diseases as the source of their animal's symptoms?
Yeah, big question. A very big question. Well, there are certain breeds that are more susceptible. And of course we're talking a vast array of different disease profiles here. I mean, it's everything from thyroid disease, pancreatitis, bowel disease, even heart disease, meningitis spectrum, pemphigus, skin diseases. This is a huge subject. And each of the diseases, there are different susceptible animals, different susceptible breeds. It is a difficult thing for animal owners to work out if they have a susceptible animal. But the little telltale signs, a reaction to a vaccine when they're given in puppyhood would be, hang on a minute, you need to think carefully about over-vaccinating this animal. Early antibiotics given to puppies, I would be a little bit more concerned about looking at how that animal reacts later on in life. Did my dog end up having a little patch of Demodex on the face when it was a baby? Because that's already saying the immune system is having a little bit of difficulty dealing with self, dealing with things that it should be used to. So if your animal is healthy, wonderful, you know, not a problem, then you can be a little bit more relaxed about it. But if your animal in that first year of life, for example, has lots of little things like diarrhea, allergies, sensitivities, problems post-vaccine, problems after a course of antibiotics or a drug given to it, then that should start you thinking, I have to be more careful with this dog in the future. And also things like just simple things people can do is avoid colorants in foods, avoid grains in the diet, just making sure that they're not putting the triggers in front of the pet.